Welcome. I'm Janet Luke. I'm the Director of Development at the Pilot School, and it's my pleasure to welcome you to the fourth presentation in Pilot School's Parent Workshop Series. We developed this series with the goal of providing useful, current information on topics that many families with school-aged children face. Tonight's topic is ADHD Basics and Beyond. And I'm happy to introduce, we have two presenters this evening. We have Samantha Spruance, who is the Pilot School Interim Head of School. And we have Dr. Kami Winkelspecht, a Child Clinical Psychologist. I'm going to be handing the screen over to Dr. Kami in just a moment. And let me see if I can pull up her card so you can see who we're talking about. So Dr. Kami will be presenting first, followed by Samantha Spruance. But throughout the evening, I'll be monitoring the chat room. So if you have questions, please feel free to submit them there, and we will do our best to answer them in the time that we've designated to this. So I'm going to hand it over now to Dr. Kami, and thanks for being here.
Yes, thank you, Janet and Samantha. And it's a pleasure to be back with you guys for the fourth in the workshop series. As I was sharing just before we opened it up to going live, this is a topic that's really near and dear to my heart. So, right, something that I started work in as an undergraduate and made me be excited about actually going to graduate school. So I'm excited to talk with you guys tonight about ADHD, and so some of the basics, and then where's we can kind of take that beyond. This is the first of kind of a three-part kind of workshop series about ADHD specifically. So as we're going through tonight, right, please make sure that you ask questions if you have them. If we feel like it would also be a topic that we could talk a little bit more about, or a question that would apply to one of our other ADHD workshop series about behavior interventions or self-care for parents and ways to kind of manage some of the stress, then we'll think about that and take some of those questions down too, if it's helpful for us to talk about that in more detail at one of our next workshop opportunities. But thanks for, again, spending some time with us this evening. So I'm going to share my screen so we can get started. Sorry, there we go. All right, so basics and beyond. So goals for this evening. So we have a lot of goals, right? Mostly related to kind of understanding what is ADHD. So thinking about understanding symptoms of ADHD in children and teens, then understanding what are the gold kind of standards for evaluation. So you hear a lot about how do you diagnose it? Is it overdiagnosed? Or a lot of questions that come up about this. So we're going to talk about kind of what are parts of kind of a gold standard assessment for ADHD. We're going to discuss treatment recommendations. So we're going to focus actually on the American Academy of Pediatrics recommendations about ADHD and ADHD treatment. Because what we know about ADHD is a lot of those conversations about treatment and assessment start with pediatricians. So we're going to look specifically at some of their recommendations. Then talking a little bit about parenting a child with ADHD. So who's a part of the treatment team? How do we kind of think about integrating kind of these gold standards, managing the symptoms, managing treatment, and then how does this team that we put together work to kind of maximize success? The goal for today is to provide education, so not to promote diagnosis of mental health conditions or prescribe treatment. So if you feel like some of the information that we covered tonight might be really applicable for you and your child, then you're welcome to reach out to me for more information or any other mental health professional who could work through some of the symptoms and assessment and treatment with your child. So resources, I'll just put some awesome resources here up front. So these are resources, I'm really picky. So for you guys don't necessarily know me as a clinician, but I am super picky about resources. And so these resources that I put together for you guys, I think are all kind of like go-to resources that I would want every parent of a child who has ADHD to know about, because I think it's really difficult sometimes to Google for information, and you can find a variety of information that might be misinformation, that might be really unhelpful. And so I think just going to these and knowing about these resources is really important. So the first one is chadd.org. It's a parent organization for parents of kids with ADHD. There are two amazing YouTube series. They're pretty long in terms of time investments, but I think you'll appreciate the investment if you decide to kind of embark on either one of these YouTube challenges by Russell Barkley. So Russell Barkley is one of the world's foremost leaders and experts on ADHD in children, teens, and adults. The National Resource Center on ADHD, the American Academy of Pediatrics, effectivechildtherapy.org. We'll talk about the treatment pieces specifically. And then my favorite book about ADHD is Taking Charge of ADHD by Russell Barkley. So all of these resources will be consistent with the information that we're talking about tonight and are a really great go-to if you're kind of looking for quick information about the topic. So parenting anchors for ADHD. So as I put on here, so if nothing else from this evening kind of sticks, my hope is that these would be some of the things that would stick. So ADHD stands for Attention Deficit Hyperactivity Disorder. It's the most common childhood mental health diagnosis. So the most common that we're going to encounter for children and adolescents. It's a neurobiological condition. So it's really important to understand that there are genetic and brain implications related to ADHD. This is not just a behavioral condition. So this is not a willful set of behaviors done intentionally by the child or the teenager or the adult, purposefully trying to forget information, purposefully trying to be distracted on other things, that this is really a neurobiological condition. So there's a difference in brain chemistry for kids who have ADHD. And so that's why, right, medication and other things that we'll talk about relate to the treatment of ADHD. But it is 100% not a willful set of behaviors. So keeping in mind a disability framework is going to help to increase success in parenting a child with ADHD. And I use disability meaning that we want you to really think about this as a skills deficit, as a developmental weakness, right? We want you to think about this when I'm working with parents of kids with ADHD, that keeping in mind that this is a real challenge for them, something that they are struggling with, and their skills are not as developed as their neurotypical peers. And so really keeping that framework in mind, I think, can help anchor you in times of frustration, because some of the traits that we're going to talk about are really frustrating and challenging. But also it's something that changes, right, over time and development, right? So some of the impairment changes, some of the areas where kids are experiencing challenges changes, and some of the techniques kind of wax and wane in their effectiveness. So it's really important to kind of keep this framework in mind so that you minimize frustration and really help that kind of your most helpful lens, right? Let's say for kids through that time. Diagnosis continues throughout a lifetime. So those symptoms and impairment will vary as children age and adolescents turn into adults, but the diagnosis doesn't go away. And so you see my caveat here, if accurately diagnosed. So if the diagnosis was a valid diagnosis initially, then you'll see the impairment and symptoms change, but you won't necessarily see ADHD go away. You'll just learn to kind of manage and compensate for some of these deficits with different skills and techniques and strategies over time. So ADHD by the numbers, an estimated 7.2 to 15.5% of children have ADHD. The numbers vary based on the study and the survey method, but that's kind of what our best estimate is about the base rate of ADHD. Boys are twice as likely to receive a diagnosis of ADHD than girls. Learning and language problems are really common, what are called comorbid conditions. So conditions that occur along with ADHD would be learning disabilities and language challenges. Almost 2 out of 3 kids with ADHD receive medication intervention. Almost half of kids with ADHD receive a behavioral intervention of some kind, and the remainder of kids were untreated for those symptoms. Boys are also more likely to have additional kind of behavioral or conduct challenges, while girls seem more likely to have anxiety and depression. So I think about them kind of as ADHD externalizers, where you have other kind of disruptive behaviors, oppositional behavior, or conduct challenges that happen, or ADHD internalizers, where, right, the symptoms of ADHD can then also lead to kind of stress and sadness with frustration and kind of managing them. So let me pause here and just ask if there are any questions, any reactions to this information. Is any of this surprising? Not necessarily. Oops, sorry. And I don't know, I can't see the little chat bar. Sorry. Oh, there it is.
Yeah, we don't have, oh, we do have a question. Hold on.
Okay,
So
good question.
Yeah, there's a question. It says, you may cover this eventually, but what is behavioral intervention?
Good question. We're going to talk a lot about behavioral intervention, but I think about behavioral intervention in a very basic sense, so that we're intervening and treating a target behavior. So something's happening that we either like or that we don't like, that we want to do more of or we want to do less of. And so that's kind of my lens for behavioral intervention. So something that we're doing to try and change a particular behavior, either in a positive way, because we want to see more of it, or we want to reduce this behavior, right, by kind of giving it a specific consequence. And so I think about it in a really basic sense. But there are a lot of ways that we'll talk about, you know, how behavioral interventions work. But just focus on the behaviors that are a concern. Great question.
There is another question. I don't know if you can see them, Kami, but it says, I thought it was now called ADD, hyperactive type or inattentive type. Is that true?
So we are going to talk about that. So there's actually 3 presentations of ADHD. There's a combined type, a hyperactive, and an impulsive presentation, and an inattentive presentation. So we'll talk about those. And those are all based on what symptom cluster that you tend to have the most symptoms. You don't have to have all symptoms to have the diagnosis, and that's the reason for the different presentation types. Yeah, but we will talk about that. Great question. Any other thoughts or reactions before we move on? I don't see any others. Okay, so we'll move on. A note about ADHD and the current pandemic. So I would be remiss if I didn't address up front that the pandemic has been a significant stressor for kids with ADHD and their parents and families and caregivers. Changes and challenges with school environments, remote learning, asynchronous learning, some words that we didn't even know right before last summer, have greatly taxed children and teens with ADHD, greatly taxed their ability to be successful. So supports typically provided by schools, traditionally that kids found and families found very helpful to promote support learning and organization, are pretty challenging to implement during remote learning, right? And in various stages of hybrid models and those types of things. And so I feel like the pandemic has really kind of put all of our supports kind of into this big question mark here. What can we do in remote learning? How do we develop new strategies and skills that help in this unique environment? Because some of the things that we rely on have not necessarily been as effective or really possible in this environment. So demands on task completion. So the amount of work that kids have had to do independently has increased of all ages. Time management challenges. So how are you going to manage kind of getting on this Zoom meeting or completing this assignment? And then how do you manage that with homework? Organization, how are you tracking assignments and making sure that you finish them to completion? Expectation for self-motivation. So it's pretty hard to actually do remote learning or hybrid learning all the time, every day. And we know that kids with ADHD have challenges with self-motivation. So attending to remote instruction is really challenging. So all of these things have really overwhelmed, I think, kids with ADHD and their families. Questions and requests for ADHD evaluation are likely to have increased. So this has been a much more frequent question than it was prior to the pandemic. So knowing that this was the most common childhood disorder and that most children were struggling with this type of mental health condition before the pandemic, I think there's been a lot more attention and focus on, is this something that's happening? Because we're all seeing kind of learning in a very new way and seeing challenges very differently. It's also a lot more difficult to assess symptoms during this time with all the changes in kind of the school environment. And as we'll talk about diagnosis, you'll see why that's really important. So let's talk a little bit about symptoms of ADHD. So when we think about ADHD and the different types of ADHD, we're thinking about symptom clusters. And so inattention is the first cluster of symptoms that a child or a teen could have with ADHD. Again, these are not required for a diagnosis, but it just gives you an idea about the symptoms that we're talking about. So trouble staying focused, and I put on non-preferred tasks. So when we're thinking about that from an assessment perspective, we're always wanting to look at that in terms of non-preferred tasks versus tasks that are preferable. So a lot of kids can pay attention playing video games because they're really excited, and the amount of action in a video game is just substantial. And so I wouldn't assess that as the primary way that I'm kind of thinking about assessing attention. So these are kind of more dull, boring tasks that are not necessarily inherently as interesting as something like a video game or a TV show. Not paying attention to details, so making careless errors. Oftentimes this can kind of pop up with math problems and math work, so missing the sign, making careless errors when you're going through things really quickly in time tests, and just missing parts of the directions. Challenges with organization. So organizing assignments, getting things together that would be needed to kind of leave for a sports activity or to have for school the next day, losing things, missing due dates, being easily distracted. And so that's like a difficulty with sustaining attention, and you're distracted by all of the things that kind of might be going on in the environment around you. So all of us might, let's say, hear a noise that's out in the hallway, right? You guys might hear a noise in the hallway here, but my ability to attend to you guys during the workshop is still significant, right? So I can prioritize attending and know that that's where I need to direct my attention. Whereas children with ADHD will be distracted by the noise and figure out kind of what is the noise, and allow that to kind of take them off task. Failure to follow through on assignments, chores, activities, so things that you're kind of asking them to do, that teachers are asking them to do. They might start it, but not necessarily finish it. Forgetful in daily routines. I think this is actually the symptom in inattention that I hear the most from parents in my clinical work that is really frustrating. So the things that you're doing day to day that are almost exactly the same are still really challenging for kids with ADHD. So the getting ready routine in the morning, doing homework, unpacking after school, those things might occur in exactly the same way most days, but kids are not necessarily mastering all the parts of that routine, that they have to really be taught each step specifically. Avoiding tasks that require sustained effort. So things like homework, something that I'm going to have to pay attention to for a longer period of time. I'm going to avoid getting started because I know that it's going to take me forever and that I'm going to have a lot of trouble on it. Losing things often. So losing hats, gloves, right? I always think about that during the wintertime, lunch boxes, leaving coats at school, those types of things. And then not appearing to listen when you're talking to her directly. So if I was talking to you and I was saying your name over and over again and you were not necessarily attending to me at all, that might be one of the things, again, that we'd be thinking about as an inattentive symptom of ADHD. So the other symptoms are related to hyperactivity and impulsivity, and I kind of collapse this category together. So being fidgety and squirmy, so I'm moving around a lot. Mostly, right, we notice that when kids are kind of seated or in a situation where you're supposed to stay like relatively still, then we see a lot of fidgeting and kind of squirming around. Getting out of their seat when they're expected to stay seated. So this oftentimes comes up in a school setting. And so kids are up and popping out of their chair to do different things in the classroom or just to stand beside their desk pretty often. Running and climbing at inappropriate times, right? So unless there was a climbing wall, right, that you might have in your house, it's probably not appropriate to climb most things that people have in houses. So running and climbing at inappropriate times can be a really challenging symptom. So how do you manage that activity level? Inability to play quietly. So most kids with ADHD are pretty loud. And so parents would say, I can know where they are at any point of the day because I can hear where they're playing. I can hear their footsteps, that they're just much louder, right, than other children. On the go, so acting as if they're driven by a motor. So that's really thinking about that hyperactivity. So that need to move, that need to be active, doing something kind of on the go all the time. Talking excessively. So really wanting to talk a lot about really anything that they might be interested in, something that could distract them, that they want to have a conversation about. They just have a high interest in talking and communicating. Blurting out answers. So this is one of the impulsivity criteria. So blurting out an answer to a question before you even finish the question. Or, hey, I think what we're going to have, what do you guys want to have? I want to have this. What do you guys want to do next? I want to do this. Before you're able to raise your hand, before other people are able to contribute. Difficulty waiting your turn, so patience. And then interrupting or intruding on others. So this can kind of happen in a variety of ways. Sometimes this can actually be like more physicality, so that you would be kind of like in people's space. You might be pushing, touching, kind of grabbing at, kind of bothering other children in a physical kind of way. Or it could be verbally, right? That you're interrupting, that you're cutting them off. And I also think a lot in this one about personal space, right? So kids who really don't necessarily understand how much space that they should have to help other people to be comfortable, that you're always kind of pretty close to everybody else. So a quick note on executive functioning. So as we talk about some of these symptoms of ADHD, We talk about executive functioning a lot more actually in the last 10 years than we've probably ever talked about executive functioning with ADHD before. But we know that there's a core set of deficits with ADHD related to executive functioning. So what is executive functioning? It's a set of cognitive processes that are really necessary for us as humans to control and monitor behavior. So it helps us to kind of control what we're doing, to monitor how we're reacting, so behaviorally and emotionally, and then helps us facilitate completion of a goal, right? So how do I monitor my behavior and figure out what I need to do to then complete this goal? We know that those things, as you heard, this set of symptom criteria for ADHD can be a real challenge. So as you kind of recall going through that criteria, you can see that it would be difficult to kind of monitor behavior and control behavior in the same way that other children might be able to do. So most executive functions that are challenges with ADHD have their origins in the prefrontal cortex. And so imaging studies would tell us that there are different structural changes and activity level changes in the brains of kids with ADHD. It's not enough for us to say like there's a diagnostic test that's like an image test that you would say this is, you know, what would indicate you have ADHD or not, but there are certainly patterns that appear over and over again related to this activity. And again, primarily the prefrontal cortex in kids that have ADHD versus not. So here's a quick example of that. So on the left-hand side, right, we have a brain image of a child that does not have ADHD. So the increased red kind of activity that you see there means increased control, increased ability to plan, increased executive functioning. On the right, then you'll see a brain image of a child who has ADHD. So you have less of that activity, and so you have less of the ability to control those behaviors that we were talking about. So executive functioning challenges of kids with ADHD, and this is just kind of a set to give you an idea about how they map onto some of the symptoms. So action, so monitoring and regulating your actions. What are you doing? And your ability to think about that. Memory, so utilizing that quick working memory and recall. So how am I able to use the information that I'm presented quickly? And then how can I remember that to use it in the future? Emotions, managing frustrations and modulating emotions. Effort, so regulating attention, alertness, speed. Focus, so that's sustaining attention and shifting attention. So you hear a lot about transitioning being a challenge for kids with ADHD, and it's partially, right, about shifting your focus to something else. Shifting your focus from a preferred to a non-preferred activity is really hard. And then shifting to something different is challenging. And then activation. So how do I kind of work toward organizing, prioritize, and planning for completion of a task, completion of an activity? And so we think about that a lot for school. You can also think about that for sports and kind of practicing for sporting events as well. How would you kind of think about the steps in that way proactively? So diagnosing ADHD. The gold standard involves completion of parent and teacher questionnaires, administered by pediatricians or psychologists typically. Those are the people who are most frequently administering those with the goal of kind of making a mental health diagnosis of ADHD. To diagnose ADHD, one must document impairment from these core symptoms. So in one of these categories or both of these categories of inattention and hyperactive impulsivity in 2 or more settings. So ADHD behavior cannot occur in just one setting. So it can't be impairing and it can't be present in just one setting, like just at home or just at school. So we need to have 2 settings to be certain that and more confident that it's ADHD. Symptoms present for 6 months or more. Children and teens have to exhibit 6 symptoms in one of these clusters. So either in the inattention or the hyperactive impulsivity or both. Symptoms and impairment can't exclusively be related to another condition. And so the examples that I put in here would be kind of a learning disability. So if we take, for instance, a reading disorder, we can't have challenges just related to the task of reading. And that's where you see the avoidance of the activities, the difficulties with focus, the difficulties with work completion. So it can't be exclusively related to one of those types of things with an anxiety disorder. So it can't appear pretty quickly or just be related to how stressed and nervous that somebody is. So a lot of these symptoms of inattention actually overlap with anxiety. You also get a lot of fidgetiness with anxiety. So you want to make sure that whoever's doing the kind of diagnosis, the evaluation for ADHD is kind of ruling out that there are these other sources or other causes that might also relate to the symptoms. A note on teens specifically. So several symptoms of inattention or hyperactive impulsivity must have been present prior to age 12 for diagnosis. And so it can't be something necessarily that just appears kind of in the teenage years. So there have to be some markers, so to speak, of this with symptoms that you noticed kind of in earlier childhood that parents would be able to report, that teachers would have been, kind of noting on report cards, those types of things for us to think about kind of that diagnosis for a first time in teenagers. Any questions? I'll stop here for a second and see if there are any questions about this material so far.
We do have a question. The question is, how does ADHD affect social interaction with peers?
Oh, such a good question. We're going to talk about that as one of the primary areas of impairment. And so I think developmentally, it affects kids differently at different times. But you can think about some of these traits that we talked about. So if we go back to, I'm going to go back a couple of slides and sorry, I'm going forward. Sorry, wrong way. My apologies. So if we go back to some of these symptoms of inattention and we think about how challenging that it might be for kids to persist in an interaction if you weren't listening to them and they were talking to you directly. If you got easily distracted and you were playing something and then you kind of lost track of that and went to play with something else. If you were also really forgetful, so we're forgetting names, forgetting activities, forgetting rules of the game, those types of things, then it would be a little frustrating. I think some of these hyperactive impulsive symptoms we see as more impairing for younger kids with ADHD. We'll talk about that a little bit in terms of development, but this kind of intrusive, being on top of them, that physicality that you see can be really challenging for social relationships for younger kids with ADHD. Also, just the high activity level can be tough to manage, right? So other kids are not going to necessarily have as much energy and they might want to play something that's a little bit more relaxed. And so sometimes it can lead to challenges from that perspective as well. That's a great question. And one I think that's really important for us to think about. Other questions?
I do not see anything else.
No.
Oh, wait a minute. Yes, we do.
Oh, maybe so.
Children mature in age. What, if any, of these symptoms might they outgrow?
Yes, we're going to talk about that. You guys are asking great questions, right? You attended with really specific things that you wanted to learn about today. And I'm happy to say that we're going to get to all of these things because it does change. I mean, you heard me say at the beginning that ADHD doesn't go away. I think what kind of gives that impression oftentimes is how much the symptoms kind of might wax and wane in their impairment in different areas, right? So in the peer area or in the organizational area and inattention as kids get older. And so we'll talk about that a little bit too. Other questions? We're thinking a little bit
right now.
Okay. So ADHD is most commonly diagnosed in childhood, though it can be diagnosed in teens and adults. I actually think in the past 15 years, we've learned a lot more about how we would kind of diagnose ADHD in adulthood because diagnosis wasn't necessarily as common and we didn't know as much about that in children and teens. And so there were children and teens who were struggling essentially that continue to struggle with those traits as adults. And so we've learned more and more about ways to kind of think about that and how the symptom criteria might change for adults. Subtypes differentiate between symptoms and impairment. So the question earlier about what are the different types of ADHD? So combined presentation, meaning that you have 6 symptoms of inattention and 6 symptoms of hyperactivity and impulsivity is the most common type of ADHD. So most kids will have both of those symptom clusters. Inattentive presentation. So we see inattentive presentation. It's actually diagnosed more in girls than in boys. And we're thinking about that just as the symptoms related to 6 or more of those symptoms related to inattention and distractibility. You'll also see this kind of as a presentation more in older kids. And so your question about kind of developmental changes in symptoms. So you might have had, right, some of those hyperactive or impulsive symptoms as a younger child, and they weren't necessarily as impairing. But the impairment from the inattention and the distractibility in the organization really grows as kids get to middle school and high school, because the task demands and the amount that we're expecting them to do to kind of be successful to manage 7 classes, changing each classes for different teachers all the time, just grows substantially. And so sometimes we'll see this inattentive presentation that might have been missed in kind of younger grades appear a little bit more in middle school and high school as those demands go up. Hyperactive impulsive presentation, that's more diagnosed in younger kids and also in boys more than girls. And so this is a symptom that we can also see. So I think that sometimes inattention, we're looking for kind of the absence of a symptom, so to speak. I'm looking for you to not be doing something to know that you have an inattentive symptom, versus hyperactive and impulsive behavior, where you're really doing something, a behavior that I can see kind of over and over again in front of me. And so it does kind of, it's more disruptive, right, to classrooms, and it actually is easier for us to kind of see right in front of our faces, so to speak, where inattention is a little bit harder to track. But you can have just those 6 to 9 symptoms of hyperactive impulsive behavior. Parents typically note challenges with this lack of inhibition, this like impulsivity activity level first. That's what parents typically report, is that they start to see challenges where kids are not able to kind of like inhibit or stop their response or stop their emotional kind of reaction to something and regulate that as well as other kids. This lack of inhibition and emotions as well, it's a lack of inhibition for emotions and behavior. So not just, right, I can't stop myself from doing a behavior like an impulsive thing, but it's that emotional reaction to that kind of 0 to 60 really quick is tough to regulate. And emotion dysregulation, though we didn't talk about that as a symptom of ADHD and the inattention or hyperactive impulsivity, many research would argue that emotion regulation should be part of that diagnostic criteria, because it's a really core feature of ADHD for all the reasons that we talked about related to executive functioning and whatnot. Symptoms of inattention become more evident over time. We talked about that a little bit as well. So as we're seeing kind of kids transition to middle school and high school, then inattention becomes a lot harder to manage. So that distractibility really means that you're missing a lot of core content. The challenges with losing things like homework, losing assignment books, not necessarily keeping track of materials as you transition from one class to the next class, that those challenges really become difficult for kids to manage and result in a lot of impairment. So that's poor grades, a lot of frustration, a lot of reminders, completing homework and then forgetting to turn it in. It becomes really stressful for kids, parents, and teachers. ADHD is really a developmental disability, and the children exhibit delays in comparison to what their neurotypical peers would show in their ability to manage these impulses, behaviors, and attention. That's also kind of evident in some of the, to your point about social skills as well, that you'll see social delays in kids with ADHD. So note on development, a couple of you guys ask about how development kind of might be impacted for ADHD symptoms, or how it plays into ADHD symptoms. As discussed already, kids and teens with ADHD experience developmental delays in comparison to their neurotypical peers. And these are based on changes in brain structure and activity level in this primarily prefrontal cortex, that control center of the brain, which we talked about. Symptoms of hyperactivity and impulsivity occur more commonly in children with diagnoses of ADHD, and they're more impairing in younger ages. So in that childhood age range, elementary school, or if we're even thinking about younger than that with preschool, that you see a lot of this difficulty with being able to sit still, being able to stay in your seat, blurting out and interrupting answers, intruding in people's space. So you hear a lot from kindergarten teachers who are noticing this, that kids are not staying in their circle, right? We all have a circle or a square. Many teachers have a circle or a square before COVID, or ability to stay in the desk, and kids with ADHD are just not able to stay in that space, right? They're just ready to move and kind of intruding in other people's space pretty often, which creates a lot of challenges. Social challenges and peer difficulties can occur throughout the course of ADHD, but they shift a little bit in the nature of their impairment as children age. So I always like to think about the social challenges of the ADHD kind of in the context of also friendship stages. So I used to do a talk that was all about actually social skills deficits in kids with ADHD. And the framework that I found the most helpful for parents to think about it was that friendship and kind of the nature of how kids make friends really changes over time. And so if we think about that, and then we kind of lay over kind of the symptoms of ADHD, it kind of makes sense why it would be a little bit more challenging and different as kids get older. So younger kids, right, if we're thinking about preschool and kind of early elementary school up until probably 3rd grade or so, are kind of in a friendship stage where you could meet a friend at a park, let's say somebody that you had no idea who they are, and then you would meet them and you guys would play happily for an hour, and then you would go your separate ways and you would call them your friend, right? So that you enjoyed a mutual activity together, you had like a fun interaction, and that's kind of the basis of friendship. So friendship is kind of this mutual activity sharing and enjoying that may or may not continue, right? So you might not see that friend again. Sometimes you could, right, if it's a peer in your class. And so if we think about some of those things, like brief interactions could be interactions where kids with ADHD are a little bit more successful, but sometimes interactions that are repeated, like playground interactions day to day with the same classmates, then some of these tendencies and traits start to appear. So kids really being distracted and kind of playing a game and then leaving a group of friends because they were distracted by another activity. Challenges with remembering the rules, remembering kind of where you are in terms of the play or the stage of the game can be really challenging for kids. Also that forgetfulness too in conversation. So if I'm talking to you, but you're not necessarily listening to me, the kids they're just not as patient, right? Younger kids aren't. So they're going to move on and they're going to play with somebody different, right? Where they're not experiencing some of that challenge sometimes. As kids get older, then the basis of friendship changes. So we kind of go from this like interaction-based play to then a relationship. And so as kids get to be kind of 4th grade, 5th grade, and then certainly into middle school and high school, then relationships and friendships are really about an exchange, a mutual exchange of enjoyment and, this flexibility kind of back and forth where, you might have, to support your friend a little bit more one time and they might have to support you, but you're willing to kind of be flexible about those things. You're not just talking about things that you want to talk about. And so that conversational part, it's less active, right? So you get this hanging out that happens, which can kind of be boring sometimes if you're a kid who still really likes a high amount of activity. So it can be kind of boring and it can be challenging to kind of engage in this relationship-based friendship with the same group of peers in this back and forth way. And so that's how you'll see some of the challenges with, social difficulties and peer difficulties change as we go from kind of that more immediate kind of friendship to kind of longer term relationship-based friendship. Any questions about that? Because I know there were a couple of questions that related to this slide. Any follow-up questions? No? I don't think I'm seeing any, but I don't know if I missed any.
Nope, I don't see anything.
Okay. So let's talk a little bit about guidelines for treatment. So the American Academy of Pediatrics, again, pediatricians are often the front line of kind of fielding questions about ADHD. And so the American Academy of Pediatrics has been really great about working with other mental health disciplines, psychologists, and other individuals to figure out how do we kind of study ADHD and how do we help to have consistency in the information that we're providing to families from a medical perspective and from a mental health and psychology perspective. So we're going to think about this in 3 different age ranges. So your preschool, elementary, up to middle school, and then kind of adolescence. Did I see another question pop up real quick? Sorry. Sometimes it's hard for me to see that.
Sorry, you did. How does the ability to read social cues play into ADHD?
Yeah, so great question. So if you think about how distractibility impacts kids with ADHD, then you're really going to see kind of how these social cues are missed. So if I'm kind of paying attention because you're saying something really interesting and I'm interested in our, kind of interaction, but then something happens over here or somebody says something and I kind of divert my attention here, then I'm missing some of what you're continuing to say. I might miss actually that you're a little annoyed with me and frustrated because I'm not really looking at you and attending anymore. So it can be really difficult for kids because of this inattention and because of this forgetfulness to really pay attention to those social cues and be using them. And we're kind of taking that information in and saying, how do I use those to inform me and let me know that somebody's getting a little bit annoyed, or because I asked this question and interrupted them 3 times that they're starting to get a little frustrated in their tone of voice. Those are just not the things that they're necessarily paying attention to at that level. And so that's how you'll see, right, social cues start to impact some of those friendships. And again, I think that happens some in that, your early elementary school and kind of that elementary school age range. But I think more you'll see some of those challenges and kids talking about some of those challenges in middle school and high school, because they're then kind of losing friendships or having challenges with sustaining friendships because of some of this social cues. They're not appreciating kind of what their friends are saying or fully paying attention to that. That's a great question. Any other questions?
I don't see any right now.
Okay. All right, so let's look at the preschooler. So what do we know in terms of treatment, and what are the recommendations that we're wanting professionals to provide to families? So if we're making a diagnosis, and this again says, if I'm making a diagnosis of ADHD, these are the things that I'm recommending. So the preschool age is defined up to the 6th birthday, so up to age 6. Treatment should start with evidence-based parent training and behavior management. So this can be delivered in a group or individual. So the 3 behavioral parent training models that we know the most about have both group and individual versions. And so we know that they're both also equally successful. And then also school consultation. So how oftentimes, again, preschoolers are kind of coming to our attention because of some of that hyperactive and impulsive behavior that can be really challenging and disruptive to a classroom. And so some consultation with the school to figure out what can we try, right, as an intervention to kind of help this child be more successful at school. Medication should only be considered as a second line of treatment. So if the prior interventions are not successful, then you would consider medication. Elementary and middle school, so that's 6 years old to 11 years old, medication intervention in combination with behavioral parent training and or classroom behavior intervention and kind of educational supports is what we would be recommending to families. And the reason that you have this kind of and or there is that sometimes parents actually have figured out kind of ways to manage this behavior as kids have gotten older. And so they might use some of the strategies, right, that we're talking about with movement breaks and other ways that they're kind of accommodating around this and see a little bit less impairment at home because it's a little bit more flexible sometimes in the school environment. And so those things aren't all required to happen, right, to get successful treatment. And so you kind of evaluate what's the need for behavior parent training and or could you get most of the benefit in classroom kind of consultation and educational supports. Behavior treatment should be implemented. So if you're going to do behavioral intervention, and so that would be treatment with a psychologist or another mental health professional with expertise in ADHD, then it should be implemented in conjunction with the family and the school. So this is not individual treatment with children. So we should have consultation, communication, and coordination. So if the school really finds this a challenging behavior, then we should be thinking about that in our, parent work and then talking about how we're going to help to kind of support them or how we're going to kind of manage that from a behavior perspective. For adolescents, so 12 to 18-year-olds, medication intervention along with evidence-based parenting training for teens and families, as well as school supports and intervention. So again, these 3 things, kind of a 3-pronged approach is what you'll hear it called a lot of times. So parent intervention skills still important, but there's more work that can be done with teenagers in terms of specific skill development and support. So this could be organizational skills training, social skills training, driving preparation. There's a whole interesting line of research about driver's ed and how do you do that effectively for kids with ADHD, just because the expectation that they're going to be transitioning to kind of adulthood is coming, right? So, I mean, this is coming, right, for high schoolers that they're going to have to learn to manage some of these skills a little bit more independently on their own. But also, so to speak, the stakes can be a little bit higher in terms of driving safety, like those types of things. And so, older kids can then better attend to and participate in treatment. And so we see more intervention, again, aimed at them specifically. Treatment takeaways. So if we're thinking about treatment, we know that behavioral parent training is super effective. So this is just what can we take away from kind of all of the treatment literature. Behavioral parent training is effective. Skills to build positive attention, so ways that we pay attention to behaviors that we want to see more of, and ways that we reduce negative attention, so ways that we kind of stop delivering attention or give a specific consequence to behaviors that we do not want to see more of, is really what's focused on very broadly in terms of behavioral parent training. There's a lot of research about behavioral parent training, so about 30, 35 plus years that tells us that it's an effective treatment for ADHD. Medication's effective and has been well researched on children and adolescents. So though I'm not a medication provider, I'm not an MD, right? I'm a PhD. I would not be doing my job well if I didn't say that it is an effective treatment for ADHD. And that about 85% of the time, kids have a significant response to medication that brings some of those symptoms that kind of met the diagnostic criteria down back into the average range. So it can be a substantially effective intervention. There's no talk therapy that's noted in the recommendations. And so classic kind of talk therapy or talking about kind of the symptoms to kids, no matter who does the talking, right? So I think this is actually one of the most frustrating things from working with parents is that talking to kids about how these symptoms are challenging or what the symptoms are doesn't necessarily result in change. And if we think about, again, kind of what were those criteria, like that distractibility, that difficulty paying attention to detail, that forgetfulness, all of those types of things are the same things that make it really challenging for kids to then take in this information and then make decisions. And so it's not that they don't want to listen, it's not that they don't want their behavior to change, but just talking about it isn't necessarily the most effective. So we want you to talk less and act more. So reinforce the behaviors that you want to see with appropriate rewards and appropriate consequences. A team approach is really best. So pediatricians or alternative medication providers are really important. So we want somebody who's kind of on the treatment team that focuses on this like physical health part and the medication aspect. That could be a psychiatrist, it could be a pediatrician, again, somebody who's a trained medication provider. Psychologists or behavioral parent training therapists. And so you want to make sure that as you're looking for somebody to do treatment, that they really have some expertise with ADHD and that they're also able to really focus on kind of this behavioral approach that we know is helpful. Again, for older kids, that's things like organizational skills training, work on executive functioning and how to help planning and those types of things. School professionals. And so I put a lot of people on the school team because the school can have a ton of people who are also really, really effective and helpful in different ways to kind of support different needs that kids have throughout the stages of development. So teachers, obviously, allied health professionals. So those could be speech therapists, occupational therapists, physical therapists, music therapists, school psychologists. So those are typically people who are going to help to kind of determine whether there's a formal accommodation plan that would be helpful or not. And then administrators. So all of these people from the school could be involved in kind of communicating and developing what's the right plan for a child with ADHD. And the most important part of the team is the parent. Parents are the team leaders. So this team does not exist and does not get managed without a parent who is really working to understand and help all of these individuals know. So helping the therapist, helping the pediatrician, helping the school professionals know what's the information that's the most important to know about my child. So parents are always going to know their children best. There is no amount that you're going to build a relationship with a therapist or a school professional that's going to take the place of the parent really knowing and understanding what are the things that are going to be the best fit for children. And so really trust yourself and that expertise that you bring to the table. I know it can be really challenging sometimes to sit in school meetings or to kind of think about, these things in the context of, all of these healthcare providers and be expecting them to kind of know what's going to be best. But I think as a parent, you always have, I call it kind of like your gut reaction or kind of your spidey sense that you really know like what's going to be kind of the most helpful and have that reaction. And I want you to trust that reaction and really advocate for your kids. Education is essential. Parents need to continually educate themselves about ADHD. So from trusted resources, not just Google searching. So I don't want you to randomly kind of search in Google. You will come up with millions of responses that may or may not be helpful. So some of those resources that I covered at the beginning, I think are a good place about where to start. But really continually educating yourself. If you read something, if you hear something on the news, then go to one of these resources and say, hey, what kind of information have they put out on CHAD about that? So CHAD's awesome about doing parent fact sheets about alternative treatments and a new study and really getting that information out to parents quickly. And this education is just super important to be the best advocate in the care for your child. So parents are always going to be the best advocates for their child. And so making sure that you have the right information and education is really helpful. A quick note on school collaboration. So if we're thinking about school, and then I'm going to transition the presentation to Samantha so she can think about this a little bit from a school perspective. And so a quick note on school collaboration. Communication is the key to success. Open, frequent dialogue with teachers and other school staff is really important for setting school up to be the most successful. So you need to kind of have a sense of what's happening in the classroom and what are the successes, not just the challenges, but what are the successes that are happening. And the more open and frequent dialogue, I think you get a more balanced perspective, right? So you don't want to wait to have the conversation when something big happens. I want to know like how successful things are going and what's working to help us be prepared for when the challenges happen. And so having this open and frequent dialogue is really beneficial. Don't assume that the school is going to know exactly what to do. So discussing a menu of accommodations and interventions is a part of, kind of working with the school, but then you're going to pick the ones that you think are going to be the best fit for your child. Again, you're going to know the child best, and then the teacher is going to know how do they learn in the classroom and what do they see. And you're going to use both of those pieces of information to collaborate on the best plan. Continually evaluating whether things are working to try something new. And try something different is really important. So this is not going to be something where you identify one solution and it's the best fit and it's going to work for several years. It's probably going to be a combination of these different things and some trial and error that's involved to find the right set of interventions at the right time to help your child perform in the way that they need to be most successful. So I would just say keep trying because your kids are worth it, right? It's really tough, I think, sometimes for parents to manage ADHD. I always say when I did feedbacks for parents, when I was giving a diagnosis of ADHD, that you can expect that it'll be consistently inconsistent. They're going to see some of these things differently kind of on different days, and the things that worked last week are then you're gonna think, I wonder why this isn't working as successfully. And it's not that the skill is the wrong skill, it's that we have to kind of continually like invent and work on these things in a new and different way. But keep trying and keep at it because your kids are really going to benefit from it. So other thoughts or questions before we transition to Samantha for more of a school perspective?
I don't see anything right now.
Okay,
So maybe we'll go on over to Samantha Spruance.
sounds great. You can take it over. I will stop sharing.
Thank you, Kami. And
Sure.
I'm share my screen. I'm actually going to give you a couple of ideas for home first, and then tell you a little bit about what we do at Pilot. And then I have some more ideas for home, but I'm thinking we may have to wait till next time, which is April 12th for that. So let me get started. Okay. So as Kami mentioned, the core symptoms of ADHD are developmental deficits, and children with ADHD, as you well know, are dysregulated in many areas that you might not think about or you didn't think about in the beginning. For example, only 6% of children with ADHD are classified as having normal motor development. So maybe you've noticed your child is maybe a bit clumsy or has trouble with their motor planning. This is completely normal for children who have ADHD. Another symptom that happens a lot is that they are very tactile defensive or they're very hypersensitive. So maybe your child doesn't like the tags on their clothes or that doesn't like to be touched a lot. Again, very, very normal. Their vestibular system might be affected as well. And in case you're not familiar with your vestibular system, it is located in your inner ear. And I like to think of it as a traffic control system because it is your traffic control system for all sensory information. It tells our brain how and when we move, and it helps us securely move, attend, learn, and rest. And finally, your proprioceptive system is also effective, and that helps us perceive the location, movement, and action of the parts of our body. So a couple of fun activities you can do at home to help these things. One is a motor planning activity, and I like this especially for younger kids. For older kids, I do it as more of a balance activity. But you set up cards along your floor and you have their footprints, so a left and right footprint, and they have to motor plan putting their right foot right in front of their left and et cetera. Sort of like walking on a balance beam without having the balance beam. I love this for younger children because it also really helps them learn their left from their right. So I usually color code it, making their right foot red. As they get older, you can work on them standing on one foot while they're doing it and hip hinging, which helps them with their balance and motor control as well. Another fun activity is feet feel. And for that, you get your child barefoot and you make like a little maze with different pillows of different textures and have them balance on it. And all these things are kind of fun as adults too. It's more difficult than you think, especially this next one. Rolling, rolling, rolling. It is actually very difficult to roll over when your arms are above your head and your feet are completely parallel. So I actually recommend putting your left foot over your right while rolling. To make it a little bit more difficult, I like to put different materials underneath it. And the children will then experience different tactile stimulation as well. And finally, a good activity for the proprioceptive system is to jump off a box onto a small spot. So they're actually motor planning and also helping their proprioceptive system. So we're very lucky at Pilot because we are able to offer specific interventions for students with ADHD. So an instructional or a behavioral intervention is a specific program or set of steps to help students improve an area of need. They are intentional, specific, and formalized. For those who don't know Pilot, Pilot is a school for children with ages 4 to 14 who are not thriving in traditional school setting. Many of our students have been diagnosed with language-based learning differences such as dyslexia, ADHD, auditory processing challenges, and executive functioning disorder. And we work on a team approach. So not only are we a team with you and your entire family, but we're a team within the school using our therapists, our classroom teachers, and our specialists as well. Pilot's supportive and therapeutic environment allows us to offer individualized interventions for students with ADHD. So we are very specific in making sure that our each environment in each classroom is supportive. And these are some questions that I pulled out because it might help you design a workspace for your child at home. So for instance, does the room feel comfortable or does it feel too sterile? Like, do all you have in your workspace is just one desk and that's it? And does the positioning of the desk or where the child's going to be allow them to feel safe? What smells are in the room and could that cause them distress? The fourth question is probably a little bit more geared towards school than the workspace you might be setting it up at home. But what type of flooring is in the room? Does it produce an echo or loud noise during walking or moving? What decorations are on the wall? And that's really, really important. You really only want the bare minimum of things that are going to help them and not be visually distracted. If they're sharing a space with you or a sibling, who else is in that space? And is that person providing support or distraction? And for some of us, we know that we might be our children's frontal lobes. So are we too much of a support? So do we have to actually get away from that space at certain times and let our children follow through in an activity by themselves? Is the artificial lighting too bright? We are so fortunate at Pilot because we have so much natural light in every room. We actually really never have to turn on our lights. But for most of us at homes, that is not true. But the more natural light your children can be exposed to, the better off that they're going to be. And finally, what electronics are in the space? Are there electronics that you could get rid of that don't have to be there? Nonverbal communication, I will say, as a parent, was a game changer for me. So especially with children with ADHD, you want to try to use as much nonverbal communication as possible. Hand signals are very effective because your child has to actually look at you in order to see whether you're saying stop, go, slow down, whatever your hand signal is. Match the picture is something that I use for my children to help them get ready for school and for any sporting event. And this is the way it worked. I don't know if you've experienced this with your child, but you say, go get ready for soccer. And they come down and they've forgotten their cleats. And like, they don't even know they've forgotten their cleats. You're telling them to go back upstairs and get their cleats or their mouth guard or whatever it is. So I used a luggage tag, and on one side of the luggage tag, I took a picture of my child with what they needed to look like for whatever sport they were playing. For my children, it was usually lacrosse. So there they were in their lacrosse outfit. On the other side of the luggage tag, I took a picture of everything that they needed to be in their lacrosse bag to go to lacrosse. And no longer was I running home to get mouth guards. So all I said to them was, match the picture. I didn't have to say, did you remember XYZ? Same thing with a backpack. What do you need in your backpack in the morning? Boom, match the picture. So that was really, really helpful. It takes a lot of stress off you And it eventually helps them. We can remember so much better in pictures. So it eventually trains their brain and trains them to make a mental image of what they need to be doing. Another thing that could be helpful with homework, match the picture, is at first show them a picture of what a finished assignment needs to look like, match that picture, then have them sketch a picture of what their homework needs to look like. And then finally, the last step would be they're making that mental image in their head. Also helpful for homework or anything else is just to list the strategies that they need to do or the steps that they need to follow. I recommend when you first start this, not to list more than 3 things, whether it be chores, steps in a process, homework assignments, whatever it is. And if you can, use pictures as much as possible. We have tranquility rooms, and I like to think of them as ready rooms because it allows children to get ready to learn. So at Pilot, we speak to our children. We want them to learn about their engine, what makes them run. And sometimes our engine needs to be slowed down, and sometimes it needs to be sped up. And if your engine is not quite where it needs to be in the classroom, you are invited to go to a tranquility room or a ready room to either rev up your engine or to slow it down. And it's never a punishment to leave class to go to a tranquility room or even to come visit me in my office or wherever you might want to go to get yourself regulated and ready for class. And I love that independence that we're teaching the children every day on how to regulate their emotions and their energy. One of the best things that I would recommend if you don't have one is to get a miniature trampoline. So one thing that it does is it improves focus and it reduces stress. So science says that 1 hour of hardcore exercise equals 3 hours of focus. So you can imagine just 10 minutes on a trampoline would increase your focus just to get an assignment done. But another thing that's really important is it's so much easier for your brain to remember things when you're in motion. So for older kids, when they're learning vocabulary, they could be doing it while bouncing on a miniature trampoline. Or for younger kids learning numbers or sight words, you could have them on the wall or you could be showing it to them. Whatever that they're doing, if they're doing it in movement, it'll help them remember it and it will keep them focused during the task. So sitting and trying to learn and memorize something for a child with ADHD, I don't need to tell you, is almost impossible. So if you don't have a trampoline, they can jump in place. You can throw a ball with them. Anything that's going to help them move is really, really going to be helpful for their learning. Some other quick interventions that you can use is a weighted vest or a blanket. Those can be purchased very easily on Amazon. Heavy work is basically what it seems like. It would be moving heavy books, or you can put something in like a plastic tub that you like buy at Target and have them push it. You can have them take out the garbage, anything that's heavy and getting them moving. Fidgets that I love, Play-Doh or any kind of squishy ball more than I love the spinners, but some of the children love those spinners. You can put a large rubber band, sort of like an exercise band, around the legs of your child's chair, and that will help them. They can put their feet and their toes and kind of rock back and forth. And you can easily make a desk chair into somewhat of a rocking chair by putting the legs of the chair on tennis balls, or just use an exercise ball for them to sit on at their desk. The last intervention that I think that we're going to have time for, and I'll talk about some other interventions and more so the mindfulness that we use. Mindfulness is paying attention with curiosity and acceptance. It's the ability to direct and redirect your attention. And I think a lot of people mistake that mindfulness is about controlling your thoughts, but it's not about controlling your thoughts. It's about not allowing your thoughts to control you. And so for our kids, it's to get them to notice when they are engaged in an activity and when they are not engaged. And I think it's really, really important for children to know that all our minds wander. And so not everyone else in the class is sitting there paying attention and understanding everything and following every direction. Some people are better at monitoring that and have the ability then to ask a question or to quickly figure out what's going on around them and catch up. But I always say to students that you'll never get in trouble for telling me you weren't paying attention, because the fact that you notice that is a major breakthrough. Scientific evidence suggests that mindfulness improves intention because it strengthens our mental muscle. It improves self-control, and it helps them observe their emotions and help us recognize when our emotions occur. And it also helps with emotional resilience. All the things that not only children with ADHD could benefit, but really anybody could. So during our next time together, I will talk about other interventions and go more specific into some mindfulness activities that you can do at home. But before we leave, I want to highlight a couple more interventions that we use at Pilot that I don't even think the children realize as interventions. And one is our saltwater pool. So the hydrostatic pressure of the water provides a blanket of deep pressure to the child's largest organ, which is the skin. And it helps your child know where his or her body is in space. It helps with motor planning, self-regulation, oral motor control, strength, and coordination. So our children go swimming at least once a week during COVID, more so when we don't have COVID. And it is such a wonderful experience for them and a therapeutic experience for them. And they don't even know, they think they're just playing in the water. And yet it is helping them so much in so many different areas. Another fun therapy that we have, again, that they're not sure that they know that they're having therapy, is our adaptive PE program. So we have what we call a little gym, and it provides an intervention for students with sensory needs. It's smaller, so that is a quieter atmosphere where small groups can get better developmental instruction, and it improves their gravitational security on our rock wall and all our climbing elements there. I'm going to skip the next couple of slides because those are more things that you can do at home, but I think that we'll have to wait for those till next time. But wanted to tell you, in case, again, you're not familiar about Pilot, is that the name The Pilot School came from the concept of piloting a new way to teach children. And that's exactly what we do. And hopefully some of the interventions that I've explained tonight show you that that's exactly what we do. Our 60 plus years of experience shows that this prepares our graduates to be strategic learners who succeed in their next academic setting. 98% of our graduates transition to a transitional educational setting, and that they're all successful. We make sure that no one leaves Pilot without having the ability to be successful in their next spot. So if you would like to learn more about Pilot, tomorrow at noon, we are having an open house, and it's a virtual open house, and you can find the link right on our website, pilotschool.org. And we're also having a summer camp, which will be in person this summer. We've actually been lucky enough to be in person this year, except for a little bit around Christmas, but for the most part, we've been in person the whole time. Our summer camp will be 5 weeks long. It starts on June 21st. And there are 3 different parts to our summer camp this year. We have our traditional enrichment camp, in which the campers will have math, writing, and reading instruction in the morning, along with some fun activities. And then the afternoon section is all activity driven. We have an executive functioning skills camp, which will only be offered the week of June 21st, and that's geared towards children who are going into 6th, 7th, and 8th grade. That will be paired with a Museum of Natural History camp that will come in. So the children will have executive functioning skills training. Then the Museum of Natural History will do an hour presentation for those children. And then the next part of the executive functioning will take the information that was delivered from the museum, and that's the information that they'll be organizing and presenting on. And finally, we have an intensive reading program, which will be based along the Wilson reading program. And we suggest that if you choose that for your child, that you choose all 5 weeks for them. And then they're welcome to stay in the afternoon for our activities. The Museum of Natural History every Monday will also be doing camps for the ones that are not part of our executive functioning camp. So thank you so much for your time and attention tonight. And I look forward to seeing most of you soon.
Do we have any questions? I don't know whether we have any questions. We have a little bit of time if anybody has any.
Feel free, right? We're at your disposal, right? If you have questions and you attended for a reason and we haven't covered it yet, please feel free to ask.
I don't see anything.
It looks like maybe.
If you do have questions that you think of afterwards, please feel free to email us.
Well, we do have a question here. It says, what kind of careers do these children tend to exceed in?
Yeah, that's a good question. So I would actually say in response to that, from my perspective, that I wouldn't have you think about like, my child's going to be most successful in these 2 careers, right? I think it's about how do you understand and kind of own managing ADHD. So own that as a parent and family, and then kids really own that as they get older, because I think the possibilities are really limitless. So I don't want kids to think I can only do this, right? Because I have, ADHD or this challenge with attention. So I want kids and families to really think about how do I own this and how can I maximize my possibilities for the future. So that's my lens, is that I don't want kids to ever see that they can't do something that they really want to put their minds to. It's about how can we help you have the skills to be the most successful in that.
Okay. How does ADHD present in children with autism?
Good question. So I think that's probably a question that's best overall for an autism expert, right? As I kind of highlighted in my presentation, there are a lot of things that overlap with other disorders, right? So in terms of attention and challenges with social skills, which we talked about, fidgety behavior, forgetfulness, those types of things. There are tons of things about ADHD that overlap with a lot of different other symptoms. Just because, you have autism though, does not mean that you would not potentially meet criteria for ADHD. And so oftentimes when I have encountered that question or when parents ask that, I think about, kind of if you have the diagnosis of autism and you're receiving pretty effective treatment for autism, then we want to see kind of what's kind of left over or what might be reassessed in a certain period of time to see, is there something else that's uniquely accounted for by ADHD? So with a diagnosis like autism, you want to make sure that you have intervention that's really appropriate to treat the core features of autism. And then again, what's not necessarily benefiting from that treatment or what's remaining or is a symptom that's not related to that, I think becomes more apparent as you're receiving effective treatment and as you're kind of understanding that diagnosis and what does and doesn't fit. And so then you're going to want to seek expertise in somebody who actually has dual expertise. And so thinking about that from an autism professional who can also provide this expert opinion about ADHD would be my recommendation.
And I would also say to that a lot of the interventions are very similar. And so what's good for children with ADHD is often very good for children with autism as well. So any provider or professional could probably help you to develop a behavior program for your child.
Right, like the picture approach. I actually love the picture strategy that you mentioned. That's one of my favorite things. Like, how can you make a list, and how can you help kids to see this without using a lot of words, which I thought was an awesome example, Samantha. That would be a really effective technique to help a child with autism as well. So a lot of those visual schedules and reminders are really helpful for that too.
Well, there's actually a question for Samantha on the match the picture approach.
Yeah.
Yeah, asking what age range works best.
Well, for my children, it really helped in high school because that's when they became a little bit more forgetful. So I tried it. So in my house when they were younger, in terms of how to put laundry away and such, and they weren't as good about matching the picture. But when they got older and the consequences got higher, it helped them a lot. And it got to the point that like they would even do it for like getting dressed sometimes in the morning. And again, my children were never diagnosed with ADHD, but they were very forgetful boys with no frontal lobe whatsoever. And it was a game changer for them. So I would say all the way through high school, I wish they were probably using it in college now. It might help them out.
Or we all might benefit from some visual schedule reminders.
Absolutely.
It's true, right? I mean, like we all might benefit from that, or we can think about, right, other activities we'd like somebody to follow a little bit more specifically. That's true. I think that your question broadly too about like, is there an age that these like visual schedules and things work best? There's not necessarily a magic age, but I think as you're also working to kind of shape that routine, you have to keep in mind reading as well, right? So, right, kids who can't really read at all and are not going to be able to read written reminders are really going to benefit more from those visual schedules too, because you're really going to need them. You don't have another way to remind them other than talking to them about them and reminding them about it 16 times. You're not going to have something else, right, other than this picture system that's going to help them to be a little bit more independent. And so you will see it used commonly to help bridge that gap to reading for younger kids as well.
There is a question asking, why does ADHD affect the vestibular system?
Amy, I have to say, I don't know exactly. I just know that it does affect those four systems, but I'm not exactly sure as to why.
So it relates to, again, thinking about kind of like the way that it impacts the brain structure. And so there's a part of, right, I mean, I said most of these functions kind of relate to the prefrontal cortex. That's where most of the research is focused around kind of increasing activity level and increasing control and the differences in ADHD. But some of those are also located in other systems. And so I would actually encourage you, if you're really interested in this idea, one of the resources that I recommended, the 30 essential kind of topics for parents of kids with ADHD. It's again a long investment. Russell Barkley loves to provide awesome information about research, but it's pretty long, right? It'd take a couple hours to watch it all. But the 30 essentials actually breaks it into parts, and there are two modules on YouTube that just talk about actually the brain functioning and the implications of that. And so I think that if you wanted more specific information about that, those would be great go-to resources because he's got wonderful examples of how that kind of looks in reality. Yeah, great questions.
Kami, I don't know if you can see this question. It says, is there any truth to the environmental factors contributing to ADHD? Or the increase in rates of ADHD, such as growth hormones in food, chemical exposure?
Yeah, so it's a good question. And I would say, I think they're kind of two different questions. And so one, we know that kind of genetics play, again, this ADHD is a neurobiological condition. So we know that there is like biology that plays into that. So that's both the genetics kind of part and component. That's a physical structure kind of the brain. But the other part is this interaction with environmental factors. And so where there's probably the most research that's been done about specific environmental factors that impact the risk of ADHD would be with specific teratogens. So things like alcohol use, right? Tobacco use during pregnancy, right? Drug use, those types of things. So that are impacting kind of brain development. There's some pretty clear lines of research that would say, yes, it would increase your likelihood of having ADHD by a certain rate. Again, there is actually a talk in this 30 essentials. You could pick the one that relates to actually this genetic, there's one that specifically talks about genes by environment interaction. And so actually all the questions that you guys asked today have kind of modules in this 30 kind of essentials. And so if you want to learn more information, I would encourage you to think about that, but we know it more specifically related to those, you know, kind of like more negative kind of substances that would have an impact on growth and development. I think the second question, so are there increases in rates of ADHD? I think has been a question that we've had as long as I've been a licensed psychologist. I think that this is a question that I've talked about with parents. And I think that part of this is also that we know so much more about it than we knew in the 70s, right? Honestly. So like ADHD and kind of its current, like calling it attention deficit hyperactivity disorder, entered kind of the diagnostic manual for mental disorders in 1978. And so, right, research really exploded from that time forward to help us really understand, you know, what is ADHD? What are these symptoms? What do they look like in kids? And how can we really effectively treat it? Though it was first kind of in a diagnostic manual in its current kind of name and form in 1978, it is actually one of the diagnoses going back to the 1800s that was talked about and mentioned related to kids. It was originally called in kind of the 50s and 60s hyperkinetic disorder of childhood, but the earliest kind of diagnostic manuals for mental health also had a category. It was one of the only categories that actually related to children. So I think it has been there for quite some time. Our ability to detect it, our comfort level in talking about it, and our ability to kind of be effective in terms of intervention, I think has greatly changed over time. And so I think for me, it's kind of hard to separate, is it increasing in its overall kind of prevalence, or are we increasing in our ability to detect it pretty effectively and then comfortable intervening and treating the disorder? And so I think for me, those two things are always kind of tied together, because it is probably likely that we're identifying more cases, but is that inappropriate? Maybe not, right? I mean, maybe we're identifying things that have always been there because we also can really effectively change it. And so behaviors that wouldn't have necessarily, or you know, symptoms that wouldn't have necessarily kind of come to attention or been part of an effective intervention now can be. And so that's how I like to think about the question. Is I think it's probably true, right, that the rates are increasing, but what's the reason for that? And is it really kind of invalid or not? Yeah, great questions.
Yeah, and then we've got a question asking, who would you recommend we talk to regarding medication?
So I would start that conversation with your pediatrician. If you have a pediatrician that you're comfortable with, who knows your child well, I think they're the first line to talk with about you know, medication. So if you've had that diagnosis or you want to have that diagnostic conversation, I think pediatricians are usually at the front line of having that conversation. Yeah, great question. Oh, I see another one about the 30 essentials. It is a video series. Yeah, so it's a video series. There's another one called, there's the 30 essentials, and then there's this other kind of like 2.5-hour entire kind of block that's about the essentials of ADHD. The 30 essentials I actually like better just because you can pick and choose, right? So if you know you want to watch one about the gene by environment interaction for 15 minutes, and you can just learn about that. And so I think it's kind of broken down in manageable parts. The one book that I recommend for ADHD, so I'm pretty picky, and my favorite has been for years, Taking Charge of ADHD, and that's by Russell Barkley. So the same person who has the YouTube series that I mentioned. He's just a prolific writer, researcher, and expert in the field of ADHD. He's a good go-to. He's also a good writer. So I think that his goal is to try and figure out how do we get kind of these take-home messages. I would hope that if you actually look at some of these resources, you'll hear some of the information that we talked about tonight. He's been a big influence in my understanding of ADHD over time. And that one is available on Amazon, I think for about $12 to $14 in its newest form. It's not very pricey.
Okay, I think we're just about wrapping up on our time. Are there any more questions? How do you differentiate inattentive presentation with auditory? I don't even know that word. Do you see it?
Auditory processing disorder?
I guess it's auditory processing. I guess it's, yeah, with auditory processing challenges.
Yeah, so that's a good question. I think that they're also assessed typically, right? It depends on kind of who's also doing the assessment, right? So oftentimes speech language pathologists might be doing auditory processing evaluations and would not be necessarily doing evaluations related to ADHD. And so I think that this is a question of, if you feel like, right, kind of both of these things, you're kind of hearing feedback that both of these things could be going on with your child, that you want to select an evaluator who would be uniquely positioned to be able to do both of these things and kind of differentiate that. So I think that's a question that, again, as an advocate, as a parent, then you would say, do you have experience diagnosing, right, auditory processing or differentiating that with ADHD? And I think I would encourage parents to ask those questions of providers, because you're probably looking for a more unique provider who has both of those areas of expertise, right? People have that training and expertise, but don't necessarily always do evaluations for both of those things, because they kind of have intervention areas that are different, if that makes sense. You're thinking about a more kind of comprehensive evaluation.
Okay, well, that was a lot of information, really great information. Thank you so much, both of you. Our next presentation is ADHD behavior management, and that is April 12th. You'll be getting, there'll be notices about it, but I think it'll be a good follow-up to this presentation.
And certainly if you have questions,
sure.
these questions have been so good, and I can only
Really good.
that when you leave, you're like, oh, I have other questions. So just submit them before, and then Kami and I can speak to them at the next presentation, or make sure we include information about it.
Yeah, absolutely, right. Give us feedback because we want this to be as helpful as it can be for everybody who's attending.
Yeah,
You guys
and I
have
will
been really
send,
a great audience tonight.
this has been recorded, so I'll send everybody a recording of this.
Thank you so
Okay.
much.
All right, thanks
you, guys.
everybody.
Take
Thank
care.
you. Have a nice evening.
You too. Bye, guys.
Bye-bye.